Your Aliquots Yeroto may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your warfarin. Excuse me. Then you need to hold your Aliquots Yeroto or Badaxa more than 2 days. When you need to hold your Aliquots Yeroto or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically, you resume Aliquots Yeroto or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Aliquots Yeroto or Badaxa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your Aliquots Yeroto or Badaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who managed your blood thinner medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. Hello, what should you do prior to colonoscopy procedure if you are taking blood thinner medication, such as warfarin, Aliquots, Yeroto, or Badaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You might need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the low-venom injection of warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR is slightly high, then you need to adjust the dose and recheck in 1 week if needed, or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the low-venom injection for bridging, then you should follow your doctor who manage your warfarin for the anticoagulant. Make sure you understand when to start the low-venom injection and when to stop before the procedure, when to resume the low-venos after the procedure. If you are taking Eliquis, Xarelto, or Pradaxa, you probably need to check your if not within 3 months. Your Eliquis, Xarelto, Pradaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your warfarin. Excuse me. Then you need to hold your Eliquis, Xarelto, or Pradaxa more than 2 days. When you need to hold your Eliquis, Xarelto, or Pradaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically, you resume Eliquis, Xarelto, or Pradaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Eliquis, Xarelto, or Pradaxa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your Eliquis, Xarelto, or Pradaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who managed your blood thinner medication or your anticoagulant so they can update recommendation in the systems. If you have any question, concern, please let me know in the comment below. Kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking the platinum such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your iron about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your iron result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for procedure. You may need to come back in 1 week to see if your INR improved, so you can plan for the procedure. And if your INR improve, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a lobanal injection if you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to proceed with the lobanal injection, it should give you a separate instruction when you need to start your lobanals, when you stop before the procedure, when you should resume your lobanals after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. So your doctors who manage your Eliquis, Xarelto, or Badaxa, or the anticoagulant will give you the complete instruction when you need to hold Eliquis, Xarelto, or Badaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further question, please let me know in the comment box below. Thank you. Cardioversion. What to do prior to cardioversion procedure if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa. Low, they may need